Good morning, everyone. Thanks for joining us today for this session on hygiene system strengthening, accelerating the SDG agenda. My name is Jamie Myers, and I'm from the University of Leeds. Experiences to date on system strengthening have mainly focused on water, and this is an exciting session looking at how the system strengthening approach can be applied to hygiene. I'm going to give you a brief overview of today's programme. After this brief welcome, we're going to have an overview of hygiene and system strengthening, followed by some quick-fire presentations. We're then going to have a panel discussion before we have a breakout session, and we're hoping to hear some of your thoughts before some conclusions and ways forward are presented. So yes, handing over to Robert for an introduction.
Thanks, Jamie. Okay, let me know if there's any problems with the tech setup or anything. We wanted to start today, well, my name is Robert Dreibelbus. I'm an associate professor at the London School of Hygiene and Tropical Medicine. We kind of wanted to start this session by talking through some of the basics of system strengthening. We realized that this is something a lot of people have been working on. Sorry. Sorry, one second. Okay, yeah. We wanted to start with an introduction to kind of system strengthening, and then we'll move into a few kind of quick presentations on specific experiences with system strengthening. So kind of after this overview presentation, we'll kind of hand them the mic over with three co-presenters here. Joining me today, we have Professor Katrina Charles from Oxford University. We have Katie Holm from WaterAid, and we have Bella Mons from GIZ and the Fit for School program. And we'll be looking at various aspects of system strengthening. Following that, we'll move into a moderated panel discussion. Joining us will be Bruce Gordon from the WHO, Lisa Rudge from FCDO in the UK, as well as Jamie from the University of Leeds. So kind of moving first into kind of, what do we understand from system strengthening? This is a new topic, or not a new topic, it's been around for a while, and there's been various definitions and concepts that have been proposed. So when we take a step back and look broadly at WASH system strengthening, we wanted to kind of just make sure we're all on the same page. We've taken the definition and the framework from IRC WASH, that WASH systems are all of the people, components, and functions needed to deliver WASH services. So this consists of various actors, so the people that are using these WASH services and the institutions that provide those WASH services. The factors here include things like infrastructure, finances, policy, and broader environmental conditions. The broad concept of WASH system strengthening is really linked with this kind of movement away from direct infrastructure provision to generalized service provision. We've got to understand when we're thinking of WASH systems that these are complex and adaptive systems, and they're characterized by nonlinear change. Meaning when we take actions, it's often hard to predict what type of end results we'll see from those type of actions. But what this means is it requires ongoing iterative approaches at both the local, national, and the global international levels to ensure that this kind of complex system is working together to ensure WASH services. So models of this are kind of the education system, where we've kind of seen the kind of complex factors that influence educational outcomes, and the health systems, where a lot of the thinking on WASH systems has emerged from the health systems arena. So like I said, we're starting here with the kind of IRC WASH systems framework. And this consists of various kind of building blocks that have been defined to help us kind of wrestle with this very complex system. So in this framework, there's kind of 9 key building blocks that really together make up a robust WASH systems. Now, I won't go into a lot of detail on these, but just want to kind of guide us through. Our presenters today will talk through various parts of the WASH systems and how their own programs deal with those. But first and foremost, we have policy and legislation. These are kind of the laws and regulations that determine WASH systems. We've got to think of planning as another kind of one of the main building blocks here. We've got the institutions that kind of provide services, and this also includes the coordination and understanding the roles and responsibilities of these institutions. We've got finances, kind of no surprise. It's kind of a basics of all of what we do now. It all comes down to who's got the cash and how it's being kind of allocated and planned for. We have to think about infrastructure and the ongoing development and maintenance of services. We've got regulation and accountability. So kind of, these are the accountability mechanisms and regulatory frameworks that kind of regulate how services are provided. We have monitoring, which is kind of making sure that we're keeping track of how things are going, ensuring data, and that data reaches the people that need it. In the WASH system strengthening, we have kind of water resource management, which is looking at kind of broader environmental resources. And then finally, all of this is underpinned by learning and adaptation. So ensuring that kind of as the system changes, we're able to kind of both learn from these changes and adapt to those changes in real time. So the session today is specifically on hygiene system strengthening, and I think it's important to kind of think through what differentiates hygiene system strengthening from the broader WASH system strengthening. And there are a few key differences that we need to think about and wrestle with. We just reviewed the kind of 9 key building blocks of WASH systems, and we're getting to the meat of this discussion, which was how do we think about the hygiene system as opposed to the WASH system? So kind of shamelessly kind of borrowed some of these ideas from the System Strengthening Initiative. But I do think it's important because it should frame how we consider and how we go about addressing hygiene system strengthening. So some key differences here. So water is a public good. We can understand that it's shared among the kind of, and where kind of who's responsible for water service provision. In contrast, hygiene is often a private kind of, it's a private behavior. It's very much bound within cultural norms, behavioral patterns. So it doesn't quite fall into the same kind of public sector that we often think of with water. What this does is that changes the responsibility of the service provider. So in kind of WASH services, our service providers are often central governments, central utilities, whereas when we think about hygiene, the service providers are often the end users, are often responsible for ensuring their own services. Very similar with sanitation, but for hygiene in particular, the service provider and the user often get blurred together. The kind of this shift in who is providing these services and who the end users are really does require different approaches to system strengthening and a different focus on where we need to strengthen the specific parts of the system. For example, market systems. They're very important when end users are kind of needing to buy and purchase things like soap or sanitation kind of materials or supplies for their home. It does have a new part of this system that we need to consider and think about in our broader understanding of system strengthening. While water is very clearly linked with kind of health and well-being, hygiene is often linked within kind of cultural systems and individual behaviors. And there's also recognition that there's different levels of political will and overlapping political responsibility. Water service provision and the kind of entire system strengthening is often housed within the Ministry of Water or Ministry of the Environment. For hygiene, this is often kind of complex and very diffusely defined within kind of ministerial systems. Parts can be within the Ministry of Health, parts are within the Ministry of Education, others are with Ministry of the Environment. So we don't have that same kind of clear centralization of focus, which means that when kind of this diffusion of responsibility between different ministries, different local government actors, and different kind of areas of service provision. So with this, there's been a kind of modified version of this kind of building blocks that's been proposed. It's very similar to the ones that we've seen before, but just something to kind of, for all of us to keep in mind as we're thinking about kind of hygiene service provision and hygiene system strengthening. This is also by the Sustainable Services Initiative. I think the main part here, the biggest difference is this kind of square here in red, which as we're thinking through these kind of broad systems, the kind of traditional building blocks, one that we need to really consider is demand, behavior, and political will, is really how this defines and fits in with all of the other all the other kind of key building blocks around system strengthening. So again, we're going to be using this IRC framework to kind of for the framing of our presentations, our rapid fire talks today. In light of the fire drill, we're going to kind of have we'll have these rapid fire presentations, and then we'll move directly into the panel discussion, and then hopefully have time for some feedback and some questions from the audience. So with that, I am going to hand it over to Professor Katrina Charles from the Professor of Environmental Health Risk at Oxford University to talk about what hygiene system strengthening can learn from climate resilient system strengthening.
Thanks, Robert. Right, so I was asked to speak a little bit about the experience on the climate resilience side. So I think firstly, from the climate resilience side, the important thing to note is that while there's been a lot of work on system strengthening, it still is very much a work in progress. There'll be a lot of discussion this week around how we bring climate resilience into the sector, and so it's by no means a solution, but it is something we've been learning recently, and therefore it's recent knowledge. So what I was going to do is to build on this IRC building blocks that Robert has presented, to explore some 5 key areas where I think we can learn from climate resilience, system strengthening, and particularly what I'm going to do here is to look at the interrelation between these building blocks so that it's not just thinking of it static, but really thinking about this complex adaptive system that Robert's highlighted as well. So the first one is about building the case for investment. So this was and has still been a big issue in climate resilience of trying to convince people to release the funds to invest in climate resilience and to do things differently. So climate resilience in water and sanitation has required a shift in thinking and change in how we invest. And so that has been very much trying to get that learning and adaptation block feeding into institutions and feeding into finance. And I think that's a big area for hygiene to think about as well. So how do we make sure that case for investment is clear? The second one is around using policy windows to drive change. In climate resilience, we have those, it feels like every day this summer that we've had an extreme event which has given us more public awareness, more awareness among policymakers about the importance of climate and climate resilience. For hygiene, we had a really big one with COVID-19, but now it's much harder to push potentially. But so how do we make sure we're ready for the next one? And so part of that is thinking about how we monitor. How do we make sure that we're going to get the data to demonstrate when we have a change and open that window for policy change so that we can feed that monitoring data into learning, into institutions, and into finance decisions. The third one, with climate resilience, one of the big challenges we had was we've gotten, we get used to how we work in our silos in water and sanitation, and even getting water and sanitation to talk is hard enough. So with climate, it was making those institutions even more complex by bringing in the national meteorological agencies, because for building in the climate resilience, we had to get those teams talking to make sure they had the right information for making decisions that was building in that climate information. For hygiene, again, as Robert's highlighted, there are new institutions to bring in. So there's much more focus on health, and while health has always been part of WASH, it's, it needs to have a different role in a stronger hygiene system. We also, and as he's highlighted, the demand management side as well. These are different ways of working, different actors that need to intersect, and we need to help facilitate that. The third one is about, I've written as challenging assumptions. So one of the big ones in climate resilience is, again, coming back to that investment case study, was convincing people that we needed to invest and do things differently. And part of that was challenging assumptions. So one of the big assumptions was that if we do wash well, it's climate resilient. And I think that's been shown numerous times to not be the case, that there's a new challenge now in terms of climate resilience. With hygiene, there are similar ones that we need to overcome a lot of people's assumptions about it, and it might be that it's people's own fault. It might be about some of those assumptions that we have about the poorest in the society and the role that they should take on. So there are lots of assumptions we need to challenge, and to do that, we need to make sure that there's that process of learning is feeding into monitoring and planning. So we are challenging those assumptions and getting that data to people. And lastly, I think that's the last one, was about building capacity for informed decision-making. For this one, it's increasing climate resilience, a key challenge has been getting usable information to decision makers and planners. So this includes the institutional arrangements to improve data sharing, that the data is suitable for their purposes, and also making sure they have the capacity to use that information. So with climate, often the climate data has been produced for a climate audience. So it's, you might find your area of operations for a water system is one very small part of one giant climate projection block. And it's not fit for purpose for the decisions you're making. So it's about improving the data that's available, but also making sure people are ready to receive that data, to use that data, that they can push back and say, actually, this data isn't fit for my purpose, or I don't understand that, and have the confidence to really engage with it to better inform their decisions. And I think that's equally for hygiene, is thinking about how do we make sure people are ready for this data, ready to use it, ready to change the decisions they're making. So that's all from me, my quick points. So I will hand over to Kate, who's going to talk on behalf of WaterAid.
Hello, I'm Kate Home. I'm Strategic Partnerships Director at WaterAid, and I'm just going to share some thoughts on how private sector can contribute to and strengthen the hygiene system. At WaterAid, it won't surprise you, we also have our own wash system strengthening framework. Unsurprisingly, it has a lot of similarities with the IRC building blocks, and in almost all of those blocks, private sector could play a role. I've got 5 minutes, so I'm just going to look at a few of those areas. These are the areas I'm going to look at, and you can see alongside them how that relates to the different IRC building blocks. So we'll start with financing. Of course, we would like private sector to be financing hygiene, but private sector have to be able to see the value for them in doing that. That can be market opportunities, and we'll touch on those in a moment, but there are also other business benefits. And at WaterAid, in collaboration with 5 companies, we did a piece of research to look at, was there a return on investment for companies when they invested in wash, so it was broader wash, in their own workplaces, in the communities where they draw their workers from, and across their supply chains. And we did this research across 10 workplaces in 4 sectors and 4 countries, and we took a combined wash approach, but it was a really key component in all of them. Hygiene really stood out, and in one of them, it was hygiene alone. And the really good news is we found a return on investment. So we looked at a return investment for the project period and combining sectors together. For the apparel sector, we got an ROI of $1.32 on every dollar invested. And when we looked at tea plantations, that rose to over $2. So that was a really exciting conversation to be able to have with private sector. And of course, as well as the regular programmes, the preventable hygiene, private sector can also respond in public health emergencies. And we have seen that so clearly and dramatically with COVID. And private sector had a real imperative to respond to that. And COVID has really shifted the importance of wash generally, but hygiene very specifically up into the boardrooms for the first time. Moving on to institution, infrastructure, behaviour change, integration, we've put a lot onto this slide, bundled it all together. So let's run through these. Innovation in hygiene products and packaging. We know that private sector are great at innovation. They're great at finding market opportunities and solutions. And if we look at the areas where that could be useful, they can bring more affordable products to market. They can help us find more inclusive hygiene technologies. And if you look at Lixil's Sanitap, that's a really great example of where they've done that. And even the packaging on hygiene products can be useful if it carries key hygiene messages just to help trigger that at that moment. The next one on generating demand for hygiene services and behaviour change. Private sector are really good at selling. They're really good at branding. They use celebrities, they use athletes, they create branding that really sticks. And that's really important for triggering and sustaining behaviour change. And if we look at hygiene integration at scale, once you've created that demand, people need both facilities and products, and often they will be looking to private sector to help deliver those. Government-led hygiene campaigns, there can be so much mutual benefit in that. If you think about companies in the hygiene sector, those campaigns are triggering the market, they're stimulating the demand for their products. So it is an absolute win-win for those companies to want to really amplify those campaigns and expand the reach. And let's also bear in mind that those campaigns can expose gaps in the market. So maybe a village doesn't have access to cheap soap, or people are finding it really hard to get hold of cheap menstrual hygiene products. And SMEs can really pop up and start to fill that gap, or we can even just see supply chains being extended. Hygiene solutions in the workplace, I've touched on already with the return on investment piece, so maybe a couple of examples. When we were working in a tea plantation, we delivered the hygiene facilities, but when we were delivering the hygiene education, we decided to do train the trainer. So we actually were enabling them to train their workforce and to be able to keep embedding that over time and make sure that that key skill was within the organisation. We also, as part of our COVID response, worked with Wash for Work, and we developed a capacity building package on hygiene so that companies could understand how to roll out really good hygiene practices for their workers as a key element for their business resilience. And public-private partnerships, these are really important, and private sector is all too often siloed as a contractor in the hygiene system, not as a collaborator. We need the relationship between government and private sector to go beyond that of vendor and supplier. And civil society can be an important facilitator to help enable that move towards a public-private partnership. Regulations, accountability and planning. We know how important it is to have a really strong, functional and independent regulatory environment. Private sector are often the deliverers of services, so it might seem counterintuitive, but there will be those in the private sector who are working to drive up standards and to be the best standard possible. And it is not useful for them to be working in a sector where others are working in a completely unregulated way. So they can be a really useful, different voice to bring in to work with governments to push for more robust standards. And similarly for standards, as they're wanting to drive up standards, particularly those companies who may be looked at for accountability to those, they can be in a really good position to work with government to understand the kind of standards that might be relevant for their sector, maybe hygiene in restaurants. And in terms of operation and maintenance, when something goes wrong, maybe the technology, who do we call to fix it? Whether it's informal workers or SMEs or the really large-scale companies, often private sector have a really key role in this operation and maintenance area. So it's a bit of a dash through in 5 minutes, but hopefully it starts to make the point. If we're thinking about hygiene system strengthening, we need to think about the role of private sector. And we're only going to see the real value of that when we fully integrate them to the system and don't just hire them to deliver bits and pieces of it in different areas. Thank you.
Just move on. Yes. Good morning. Thank you for the previous presentation. I just move on. My name, can you hear me? Yes. Okay. My name is Bella Monza. I work for GIZ, specifically under this Fit for School approach. And my hat here today will be wearing a bit the head of the WINS network, where the GIZ is running the secretariat and looking how WASH in schools can be accelerated through education system strengthening. And you can see the organizations in this Wash in Schools network contain really most or many important or relevant organizations are members, and please look at the website and you can all become a member there. For Wash in Schools, it's clear ministries of education are really the duty bearers for children's health and well-being while they are in school, and they really have the important role of ensuring that children have access to drinking water, sanitation, and hygiene. But even this is the case, this is the data from the JMP, the Wash in Schools coverage. You can see the global coverage, and you see the first column is water, then sanitation, hygiene, and hygiene is the weakest. And if you look at the numbers for Eastern and Southern Africa, it's a shame what we see there. I would like to take your attention to the so-called Wash in Schools International Learning Exchange. This is a format, has been established by GIZ and UNICEF and the WINS network, Water Aid, Save the Children, to really bring together governments to learn from each other. This was initiated in 2012 for the first time in Asia and took place every year. And in 2016, for the first time, we used the so-called enabling environment matrix, which is very much patterned to the building blocks. So all these countries participating in these international learning exchanges, using in preparation, really going through these different building blocks. So it's a tool since 2016. We use this, and it's very similar. It also contains the key elements the WASH sector is using, the elements we have seen before. And it's something to facilitate a process on country level, bringing together the ministries of education and the key partners in the area of WASH in schools to go through sort of a stock-taking and planning process. The system or these building blocks have been slightly adjusted to really use the language of the education sector. And I'm briefly guiding you. This is how it looks. You can download that also from the WINS network website. I will place the link later. And each country is going through this, and it's being discussed during the ILE. And it's basically, it's WINS policy and planning, and you look and fill in like a color coding system. Is there a national policy existing that includes WASH in schools? Is there, you have a roadmap? Are there clear roles, responsibilities between the ministries at local and also subnational level to really see how WASH in schools is structured within a country? Is there a functioning coordination mechanism existing? How WASH in schools is being managed on country level on the different government structures? For budget expenditure, is there a proper budget existing? Are there financing plans existing? Is there a public sector budget line that is adequate to really reach the national standards? And more important even, is there money for operation and maintenance? It's not just infrastructure, also how to run it. Yeah? Then I think there is a system, then there are clear questions on monitoring. So is WASH in schools monitored in the education management information system? It's all about how you get this into the system. And looking again here is really how it's being managed within the education sector, bringing also all the other partners together, looking into one direction. Yeah? And is a monitoring system there which also is acknowledging good performance, yeah? So to incentivize the partners. Then it's also clear, are implementation arrangements there? Do you have very clear implementation guidelines, how this entire policy is being implemented? What are the clear instructions to the different levels? Yeah? And also, is climate risk assessment part of it, yes or no? Yeah? So you guide these process through governments going through the process, looking at these different aspects. And of course, capacity building, does the Ministry of Education have a plan or a strategy how to do human capacity development? And what are good models for it? So, and this, just as a information, the Wash in Schools Network has also published a publication called Wins in Focus, where you can see good models of the certain different aspects. And again, we speak about hygiene, but in the education sector, if you look for wash in schools, you cannot separate hygiene. It's very important to keep it as part of an entire wash in schools policy, implementing guideline. And there's a part which covers hygiene, but it's not separately strengthened. It's very important to keep it as a whole wash in schools approach for the education sector. Yes, thank you.
Thank you very much, Bella, and Kate as well for those quick fire presentations. So what we're going to do now is jump to the panel. So I think I can hide that one. And so I'd like to welcome up here our panel. We have Jamie Myers from University of Leeds, Bruce Gordon from WHO, and we've got Lisa Rudge from FCDO online. So I'm not sure if we're able to bring up Lisa's video as well. Hi, Lisa.
Hi.
So I'm going to need my headphones on to hear you. Right. Okay. You will need your headphones to hear Lisa, so don't get rid of them altogether. So we wanted to have want you to help reflect on some of these quickfire presentations you've just heard. So first of all, I'm going to go to Jamie. So Jamie, you're a researcher, you're active in the sector. So based on your experience in wash system strengthening, what have you identified as a good entry point for hygiene system strengthening?
Okay, I'm not sure I'm going to say anything innovative or things which haven't been said before, but I think things which are important to reiterate. Firstly, kind of these systems don't really work. These systems don't exist in a vacuum, and there are delivery systems and delivery mechanisms, which I think Bella mentioned. Sorry, you both mentioned in your presentations, which exist already. So try to strengthen the existing systems in place rather than introduce new ones. Something for hygiene in particular, the personal, individual, behavioural nature of these practices, I think is important to consider. And I think we're not really there yet in terms of how people or end users or people whose behaviours we're trying to change are in those building blocks. So I think we need a bit more kind of thinking about how they can contribute and how where their links are to the building blocks, which we're all becoming familiar with. Yes, I had one more point. Yeah, and I think it's a relatively unexplored area, I suppose. So the more experiences we gather in different parts of the world, I think having someone who has a good overview of what's taking place and what's emerging and what kind of good practices emerge, and seeing the kind of connections, so we can kind of build up a body of evidence and practice as we adapt and work on systems in different contexts, as well as acknowledging the contextual differences, I suppose, and trying to draw out those lessons learnt.
Okay, great. So really about not reinventing the wheel, but strengthening what we've got to deliver better services, recognizing who is involved in those systems, and learning from all the work we've done over the last few decades in WASH more broadly, and already in hygiene as well. So, okay. Lisa, I'm going to come to you next. So I wanted to ask you about from your perspective in FCDO, what are the challenges and opportunities in thinking about hygiene as part of wash systems and part of health systems? So where's that crossover and what are the implications for system strengthening? So it is, this new institutional setup, we're shifting it a little bit, but, to a certain extent, we've been doing this for a while. So what do you see as these challenges and opportunities?
Hi, Katrina, and hi, everyone. I hope you can hear me.
Yes, we can.
Yeah, great. Lovely to be with you, even though virtually. I hope I don't have any massive spots on my face because I feel like my image is huge on the screen. But listen, really important question. And so I work as I'm a WASH advisor and work as part of the global health team. So we do kind of think about this a lot. And I'll come back to silos, and how difficult they are to break down. But firstly, just to say that, from what we've heard in the presentations as well, of course, there's lots of crossover between the WASH and the health systems. But there are also crossovers in fundamental parts of the system, as in, some of the wider basic things such as planning processes, procurement, civil service-wide HR processes. And these are common to the different sectors. So we mustn't forget either that part of our system strengthening and hygiene system it also goes beyond those, and strengthening those broader systems can have an impact on the WASH, the education, the health system more broadly. So working in partnership with our public financial management colleagues and others is also an important part of WASH systems. Secondly, just to say, of course, both the WASH system and the health system interact with communities, and that's been a strong point, I think, in the first presentations. But they also all need data and monitoring and digital tools as well. And so there are real opportunities there to use what we've learned and use those entry points to strengthen both systems. So you'll understand that basically the synergies and exploiting those synergies are really important when we're talking about system strengthening. Yesterday, I was in a session and we heard how difficult the fiscal and financial environment is and how limited resources are. So really thinking about those synergies and pooling resources is absolutely fundamental, and we should try to not see all those systems in isolation, but really look at the crossovers. So you asked about opportunities. Clearly there's no hygiene, there's no public health without hygiene or WASH more generally. We can really learn from the health sector and must work with the health sector and vice versa. I think the health sector also hopefully will give us some pointers as to how to strengthen, how to measure the strength of the system. And I think, Katrina, you said we're learning, and we definitely have a big learning curve on that one, I would say, in the WASH world, although there has been progress, of course, on the hand hygiene acceleration tool, which helps us firstly identify what the current hand hygiene system looks like, but also monitor progress. So they're important elements of progress as well on hygiene systems. One other opportunity is the private sector, and we heard a lot about that. But clearly, hygiene is business, and therefore we definitely, that's a massive opportunity working together. But that's already been said. There's a huge opportunity, and maybe Bruce will come to this. Sorry, Bruce, if I steal your thunder, but it's about working through primary health care and really getting our health colleagues to do a lot of the legwork on hygiene. And working on infection prevention control, which possibly there's something there for us to do as well in working with the private sector at the healthcare facility to help further the infection prevention control agenda as well. And of course, they're seeking efficiencies. And I think, again, I'm quoting the work of others, but WaterAid have integrated hygiene into vaccine campaigns. Again, a great kind of example of where the efficiencies are. So what are some of the challenges? And I know I've got to be quick, but some of the challenges I would say are still around planning and intersectoral planning. and who funds and finances, and where do those finances go to? Do they go to the WASH project, or do they go through the health sector? And I think it's important that through multi-sectoral plans we align those thoughts and the funding. I think again, so you'll have understood my key points are collaboration and breaking down silos. Those are absolutely critical for making those opportunities function. Joined up action. And someone once said, one voice, not competing voices, is absolutely essential. WASH, health, food and nutrition systems, they're all important. Thanks.
Thanks very much, Lisa. And I think I'm going to be a bit provocative, but I'm not going to ask you to answer this straight away. You can choose to answer it later if you want. But what can we learn from the fact that while health systems have strengthened, and there's a lot certainly we can learn from health in that area, but that WASH in healthcare got so left behind? What is it, what do we need to think about to do differently to improve, and improve that system? So I'll just throw that out to everyone, and then we can come back to it if people are brave enough. Bruce, I'll go to you next. Go back to the standard agenda. Based on what you know and what you've heard today, and you've got a lot of experience with WHO in all areas of WASH and hygiene and going into health as well, what would your call to action for hygiene system strengthening be to national governments?
Okay, well, thanks. And I'd like to maybe just touch on your question that you mentioned to Lisa. First of all, I agree with everything that's been said. I mean, this is a fascinating issue in the sense that it's a challenge. And we talk about systems, and I think many of us kind of think, well, systems are kind of everything in a way. It's a little bit intimidating to think we have to deal with all of these. And I do feel like this hygiene is something that absolutely needs to be carried as part of a WASH system, as was said, integrated in, but it also is part of a health system. So already there it gets quite difficult. I mean, I think answering your first question, the issue of a call to action, I would say we really need to reiterate what happened at the onset of COVID, where UNICEF, WHO, and partners around the world issued a call to action on hand hygiene for all. And, the big part of that was actually to get national governments to develop roadmaps, essentially to kind of bring together their kind of planning and their institutional coordination to progressively move forward on hygiene. And I think that's the big issue. You mentioned primary health care, Lisa, and I think so. Where on the health side, where does this get embedded in a system? I think some people in the WASH sector think of health and they think, oh, there's health and it's all nice, but it is lots of vertical disease programs and lots of, that should come together as primary health care. But at the end of the day, system strengthening is a long-term, kind of effort, right? So we've seen hand hygiene and hygiene in particular, it gets scaled up and scaled down really, really quickly. And that's both an advantage and a disadvantage. What WHO did at the time was, like everyone else, call for people to wash their hands. And then we have very senior people saying, well, they can't because they don't have the means to do so. So there's the issue of behavior change, right? And then there's the issue of, do you have water? Do you have water? Do you have soap? Can you do these things? And I think through what we our big concern is that when the world prepares for the next pandemic, and there is a sort of pandemic preparedness treaty happening and being negotiated by governments, that hygiene is included in that. It has to be, but you may not be surprised to find out that in the initial drafts, it could be strengthened quite a bit, despite everything we know about this. So we're always having a bit of that trouble with sensitization, I think. And so I guess then the question is, what is the role, of government? And we heard private sector as, a big part of this. But, we feel that there needs to be a lead agency. So we would ask governments to provide that. For us, a good lead agency would be health, because it's obviously a health intervention. But it could be situated throughout. But as long as there's coordination, because I think that when you look at all the issues around, if you break down a system from all the way through from policy down to, kind of financing, the whole issue of who is responsible, who is actually going to coordinate this, that's missing, right? So that seems to be a, something that, and even in WHO, is there any group in WHO that is looking specifically at hand hygiene in community settings? Well, we are to a certain extent, but there's a very strong infection prevention control program that delineates itself just to healthcare settings, and schools is sort of similar. So in a way, we've got to kind of get together, and we've got to actually do the hard work of planning this out so it meets a long-term need, right? And while we can deal with emergency response and put up posters and tell people to do things, this has to be integrated in the clean water, universal access to water agenda. And I'll just conclude by saying this on preparing for the next outbreak. And we know there's cholera outbreaks, the greatest resurge in decades, and this doesn't necessarily is seen as a tool to to kind of deal with that as much as it could.
Okay. Thanks very much, Bruce. Lisa, if you want to come back in, just wave at me and I can see you. But we will come to the audience for questions in a moment. So do start to think of your questions. But what I will do what I've got is for each of you is one last question overall. And that's what's the priority here? What do you see as the low-hanging fruits for hygiene system strengthening in these different settings that you're working, that we can really start to, we should be walking away from here and saying, right, this is our next thing to deliver? Or Jamie, are you happy to go first?
I can try. I feel I'm just going to reiterate what others have said, though. And I'm trying to distinguish in my own head, I suppose, what I think we should start with and what I think the easy wins are, because what I think we should start with are not necessarily going to be easy in all contexts. But yeah, I think I just agree with what Lisa was saying about the opportunities, kind of coordinated action, thinking about existing delivery mechanisms within the WASH sector as well as beyond, and working out how we can deliver those messages. But also, maybe this isn't answering your question, but I think we also need to think about systems which are going to reach those who are often missed out. And so I think when we're taking this approach, this systems approach, the system which is going to deliver for the masses and not necessarily the system who are going to deliver for the poorest and most vulnerable. And we need to be, even though it's even harder to deliver for those particular populations, it's important that when we're looking for those quick wins or low-hanging fruit, we're also kind of thinking about ways we can adapt our processes and programs so we're kind of not missing people and leaving people behind.
Yeah, so one of the key areas I would say in that certainly is how you get soap to people who can't afford it. How do you make soap affordable for all the population, which is one of the things which I think is somewhat different from what we've done so far in water and sanitation, is thinking about different financing mechanisms and working with the private sector quite differently. Yeah, and acknowledging that the private sector isn't going to be able to reach a certain cohort, and then how are we going to be delivering hygiene, supporting them with their hygiene needs? Yeah. Okay, and I think there's a bit of room to push back on me too, and because I'm not sure that low-hanging fruits and easy wins are the same thing in a system strengthening environment. So, but Lisa, can I come to you?
Yeah, thanks, Katrina. Maybe I'll start with your question. And in a way, it is a low-hanging fruit, but it might be slightly difficult to finance. We know how to do wash and healthcare facilities. We know how to do infection prevention control. So you're right. There's no reason why why people are using health facilities without adequate wash. However, I think that there's some low-hanging fruit there. We're not as good as the health sector at using the evidence to demonstrate the investment case. So that is really important. And I know we talk about it all the time. There's some obviously new evidence, and WHO, again, Bruce, sorry, but around the burden of disease against reducing upper respiratory tract infections. Those are all really critical. And then it's translating that into a, I guess, monetary benefit over the long term for the health sector to invest. But ultimately, the pot of finance is the same one, whether you're in the health sector, wash sector, etc. So, you know, it's about thinking where those priorities are. And so the principles of political leadership really came out strongly at the last Wash and Healthcare Facilities Summit. So that's really important. But just on the low-hanging fruit, I mean, I think sharing data between sectors is really important, and that's kind of links to the point I just made. Working through the primary healthcare and health extension work-ins, again, the synergies, and using digital technology, I think through the hygiene responses during the COVID-19 pandemic, we really learned how to use digital for hygiene behavior change. And that is such a low-hanging fruit and such a win-win that we should really focus a lot of effort on that as well. Thanks.
Bruce.
Okay, thanks. Just maybe touching on Lisa's last point about acute respiratory infections and the burden disease. I mean, I think that's kind of what we're driving at a bit today, in the sense that, okay, why are we washing our hands? I mean, and it's not just for some, you know, Ebola outbreak or a SARS-CoV-2. You know, it's about reducing endemic disease as well. And so, you know, and we've all taken our masks off, and that's great, and no masks are being distributed. There's a few alcohol-based hand rub stations around. But I mean, just this idea that we need to continue to, I guess, to champion the benefits of, you know, continuing to take some measures even while, you know, we're not in an emergency. And so I do think that some of the evidence, harnessing that evidence, is important to bring out to policymakers. And that has been the single biggest contributor to our new WASH estimate on burden of disease, is the hand washing component, reducing pneumonia and things like that. So I think that's very important. And it leads into this bigger point, I think, about, you know, accountability and monitoring and, you know, political kind of commitment. And that is, you know, Bella, you mentioned the joint monitoring program figures in schools on WASH and healthcare facilities. And those, so we have country by country estimates where they exist, generally on schools, healthcare facilities, and households. They're kind of forgotten about when we talk about them, you know, in the sense that, you know, it's always water, and to a certain extent sanitation. And so we need to kind of bring that evidence that exists on burden of disease and on access to the policymakers, and also to the health policymakers, not just to the WASH policymakers. We also have a monitoring program on glass, on the investments, and we see when we follow the WASH accounts, which looks at financial flows to WASH, some national governments are accounting for hygiene expenditure, and it's very, very low, but it's interesting. As soon as it's on the radar screen, at least someone's talking about it in a discussion, so that's important. And then the last thing, and I'm sorry I'm talking about the WHO processes, I'm not trying to be a salesman, but we do have guidelines coming out, which may seem to be a minor issue in terms of it's another document, but at the end of the day, there's a power in formal guidelines on how things ought to be done in terms of a long, rigorous process of evidence collection and expert recommendations. And there will be recommendations and implementation to sort of say, these are the elements of system strengthening that need to be, you know, kind of checked off for you to be in alignment with this. So we look forward to working with all of you and, you know, and others to try to bring, you know, coherent, agreed consensus recommendations, you know, to governments around the world as part of WASH policy to begin to sort of respect the process. There has been no guideline on this before. There's been water guidelines since 1957. So WHO in 2024 will, for the first time, have guidelines on hygiene in community settings.
2024, huh?
Sorry, hold on a second.
Yeah, that's
2023. Yeah, no,
2023?
No, 2024.
Yeah.
That's not too long from now.
Yeah, no, I'm just thinking of where we are in the SDGs, you know, that puts you.
Well, as
But,
far as
as you
guideline
say-
development processes, it's, anyway.
But no, I think, I'm sure all of us here use the WHO guidelines religiously and are very familiar with how important they are and appreciate all those processes that go into them. Yes, it's much more about the political will behind it, perhaps, that has delayed the development of these. Okay, are there any questions from the audience for our panel? We've got one up here. Do we have a microphone? Yes. So there was one over this side. Thank you. Are there any others? I would like to gather a few at a time, if possible, so people have a chance to think about them. Another one there. Great.
Hi, yeah. Thank you all for the presentations. My name is Jeremy Lakin from RTI International. I liked how you spoke how ROI is kind of the best way to speak to the language of private sector actors. As a USAID implementer, I'm often talking with donors and then not just national governments, which I feel we've discussed a lot today, but more often municipal or provincial level governments. So what do you feel are kind of the best ways of speaking their language in terms of prioritizing hygiene investment?
Thank you. And can we get the microphone? There are 2 questions here as well. We'll take a group of 3 questions.
My question is on, I think there was an issue on private sector being a collaborator, moving away from supplier or contractor. How practically can we do that? Because they are maybe profit driven and that takes them away maybe from just doing corporate social responsibility to taking a bigger role. So how do we practically do that? Thank you.
One more there.
Can you hear me? Oh yeah, thank you. I have a question here from a colleague, and it's for Kate. My friend would like to learn the main points on of how you think or believe WaterAid has contributed to strengthening hygiene systems, and what can be done by all stakeholders, not just WaterAid, moving forward. Specifically looking at what good or effective hygiene systems strengthening looks like. Thank you.
So we've got 3 questions. Kate, you don't have to jump right up. It's okay. You can have a moment to think about it. So we've got 3 questions around the return on investment and how we engage with the private sector, how do we get them to have a bigger role, and then looking at WaterAid's role in it. Who would like to jump in first?
Was the first question about speaking to governments or just speaking to the private sector? To governments. Okay. I wonder if it's about, if we have some of the data already, it's about how we package it and how we present it rather than having to collect new data. I can speak on some work I've been doing on sanitation, not on hygiene, but I think kind of ways we can trigger and galvanize action of local governments is I like presenting some of the health outcomes in their particular regions in kind of provocative ways, I suppose. I also think creating some healthy competition between subnational districts have also kind of helped galvanize subnational commitments in the sanitation space. I think, yeah, repackaging and trying to create some sort of competition and incentives for subnational governments to invest and commit and push sanitation and hygiene.
Bruce, do you want to pick up on some of these questions?
Yeah, I mean, it's a good question, and it probably varies on who you're talking to. I mean, I guess there's a couple of things. I guess you were talking about municipal leadership, right? And they're juggling, like any decision maker, a lot of issues. So you're kind of coming in and trying to make space for something you think that they should do. And so it's a bit easier when you've obviously got demand from the community. And in this case, you may not necessarily have that. You might. So I don't know. I think it goes to a broader question of WASH, which is, I don't think anyone's particularly against it. It's just they, A, feel like maybe someone else will do it, or B, they haven't been presented with a solution. You know, because no decision maker, or not many anyway, or a boss will walk away from a good idea if you kind of give them a little bit of the A to Z on how it may work. And again, as you were saying, Jamie, about maybe some of the benefits. So yeah, I mean, but I think probably the most, I do think some of this practical stuff is most important, in the sense that if there is existing projects that they're already committed to, or that have a little bit of more political, you know, kind of oomph behind them, that it's integrated in with that. Like it would be a missed opportunity not to integrate hygiene into something that they've already sort of invested in, rather than kind of dangle it as a standalone opportunity that they should like make space for.
And we know some countries are using climate programs for that, where climate has a lot of political will behind them. But there's an opportunity to bring in hygiene into those ones as well. Yeah. Lisa, did you want to reflect on any of these questions?
Yeah, thanks. So yeah, I think it goes back to the point on synergies. And I think if you can show a municipal government, you know, that by investing across a different number of sectors, you get good outcomes. So for example, it's not just about, you know, the challenges, you need soap, but you also need the behavior and you need the water. So by setting out exactly what that package looks like and how much it costs, and then what the benefits are, that helps. So I think it's about having this evidence and data-driven approach, even at, you know, at that level, because as Bruce said, everyone's kind of weighing up what investments they have to make. Just on the point with private sector, I think there's a lot happening with regards to using the sector to reach last mile users. So for example, we have a partnership with Unilever, and we're working on those markets for some of the most difficult to reach areas. And that obviously is, you know, we talk about blended finance in a lot of ways, but that is about blending finance, isn't it? It's about using grant funding to test some of those opportunities, to bring some of those market opportunities, and then the private sector can take over. But of course, in order to do that, you need a partnership, right, with government as well, and a strong environment for regulating. And that's where I think the guidelines as well, Bruce, come in, and those will help have that discussion with governments, so that everyone's got their place, I suppose, in the hygiene system.
Thanks. And Kate, do you want to come up and
share your mic? So in terms of where the question about water aid and hygiene, so I think a large part of the value of water aid is that we aim to do work on the ground, which is to demonstrate how things can be done and to learn from them, and then to influence with governments and others, and that we see ourselves having a real role around enabling collaboration, about helping to break silos and facilitating, and I think that's really important. You may not be familiar with our new strategy, but in our new strategy, one of the aims is health, and that's more different than it sounds. So maybe before we were looking at getting WASH into health systems, this health one is about how we really engage with the health sector to make them really care about WASH, which obviously includes hygiene, so to make them want to drive this, which we've been hearing a lot about. And so we would see trying to get WASH and hygiene integrated across sectors being a key part of our role. In terms of private sector, I mean, I don't think the fact private sector want to make a profit needs to be a problem. It's how we can really utilise that and stimulate it. So for me, the exciting thing about the return on investment piece is if it actually helps you make a profit, not just do the right thing, this shifts it completely out of the CSR space. This is good business strategy. And it sounds quite small scale when you're talking about business operations, but when you think, for you to get that ROI, you need to be in the communities where your workers live, because you can't do great hygiene and then have your workers going home and having no hygiene at home, or their kids still being sick and you having to look after them. So we're suddenly looking at not just the workplace, we're looking at the environment in which they're based, and we're also looking at that rippling it through their supply chain. Suddenly, we are talking about scale, and it does become exciting. And I think I was trying to highlight that there are various areas, whether it's hygiene change, they own the channels. They're the media, they're the radio stations, they're the social media. That's the voice, really, we want to be getting out through. And I do think that their ability to do these market-specific products, if they see there could be a profit somewhere, even if it is about the more affordable products, that they will find a way to bring that to market. So I wouldn't kind of think that because they're after a profit, that's a problem. It's where we can make that work.
Thanks very much, Kate. I should mention at this point, because of the fire alarm, we have been given a little bit more time. We were going to go into an audience engagement session, but the layout isn't very conducive to that. So at some point, Robert's going to interrupt me. But in the meantime, do we have any more questions? Before I start going on with my questions. Robert, yes.
Yeah, I had one for all of the panelists here. You know, when we talk about hygiene, I've noticed kind of as we've progressed, we've increasingly referred to hygiene as water, soap, and hand washing. So we're taking kind of this broad, and one of the challenges around hygiene being that it is very broad and it does cover quite a number of behaviors and practices and norms. But when we start talking about it and we start thinking through these plans, we almost instantly start reducing this down to hand hygiene and making sure that hand hygiene is a viable behavior. I think, you know, just for the panelists and for the original speakers, what are the thoughts on how we can kind of address kind of the broad spectrum of hygiene within a hygiene system strengthening framework? And how do we not forget about all of the other important aspects of hygiene? So food hygiene, surface hygiene in appropriate context, kind of just broader issues around environmental hygiene. Or does the fact that this is so broad kind of, you know, reduce down the utility of approaching it from a system strengthening framework?
I can take that one first if you want. You going to? Go.
Sure. No, it's great. I mean, I actually feel, you know, as we were talking before, Robert, I kind of feel like I do both in my own mind, and I feel like there's a reduction to those three elements, and then on the other side there's this broader hygiene piece, which is really interesting. And just anecdotally, I need to share the story with you, because I feel like the greatest difference I've ever seen, kind of a water intervention, was in a slum, I think it was in India, and it was all about the greater hygiene component that you mentioned, because they got essentially free water supply, but the quantities were, you know, they weren't limiting them. And so suddenly it was the streets were clean, fecal, excreta was taken care of, the houses were clean, you know, the hands were, everything. Like, it just really, if you think about like fecal oral transmission, like, it was just, we were able to sort of deal with it, or they were able to deal with it, and then also transform themselves. So I think if you walk away from a bit of that broader definition, it's a mistake. And I think we should kind of think about like those as incentives to that question, you know, about how to convince a municipality. Like, are they thinking, you know, are we putting alcohol-based hand rubs in, or are we actually going to transform this community into a cleaner community that's more desirable to live in and visit and spend time in? You know, like almost like a green space. Like, that's what we're talking about. So I think it's a good point.
Bill, yeah.
I think for schools, it's really the aspect of making the school a healthy place, which means you develop a culture of cleanliness. And that is part of this hygiene part. This is not just hand washing. It's not teaching about hand washing. When I speak about washing in schools or hygiene in schools, it's not teaching. It is really making it possible that it happens. This means also, hygiene is also menstrual hygiene. You have possibilities to properly manage this in schools. This has to do with how the toilets are, that you can lock them from the inside, that you have a trash bin where you can dispose properly. And all these things belong to hygiene. It's not just hand washing. But if you look at the GMP indicators for hygiene, it's the availability of a hand washing facility and the availability of soap. But these are parts of, let's say, a bigger part of that's what you measure, but you have to work on installing a hygiene a culture of cleanliness. I think that is something which fits very well to schools, and this is also where you expose a huge proportion of the entire society to hygiene concepts. And important, it's not about teaching it with a poster at a wall, make possible the facilities are around and certain routines. Schools are organized around routines, so you can really get certain routines moving. Yeah, so I think, thanks for the question. I think this is really showing it's not just having hand water and soap. It's sort of a cultural move, and it's not happening from one day to the other. This is something that takes quite a lot of time.
So I would agree with that, with the comments already, that, you know, yes, it has to, we know that there's a very complex system around hygiene that impacts on our health, and we need to address all of that. And so, you know, some of our work is looking at the impact on hygiene on drinking water quality. So we can't disentangle those things. They are intrinsically linked. But to advance things in many settings, you have to have a single message. And the decisions that are made are going to be driven by the data, hopefully. You know, this is the hope. So it does come back to what is it that you can, at some point you have to separate them so that you can have a single message, and you have the data to support that message, I think. And that's working out, as you say, for schools, hygiene has to be part of WASH. But there are other instances in which hygiene has to be separate and which hand hygiene has to be separate again. And so working out where are those spaces and whose job is it to keep making sure that they all work together. But how can some of us split off and do those individual messages and really push individual parts too is an important part of that system to understand. Lisa, yeah.
Yeah, can I just add, I think what we're really discussing is a One Health approach. And I think perhaps we have a kind of macro view of hygiene, and that is one message. But then again, yes, my reflections were about this tension between spotlighting something that is really transformative and going to make a massive change. So hand washing and hand hygiene, or the use of alcohol-based rubs during the pandemic, was absolutely critical because not everyone had water, and so it was really important to move to hand hygiene rather than hand washing with soap. So I guess what I'm saying is those it shouldn't be one or the other, but maybe we just need to be better at saying, actually, we are part of One Health. Hygiene is that big system. It cuts across all of those things, but then within that, these are the things that, you know, we absolutely need to do at this time or that time, etc. So I think it can't be one or the other. Yeah.
But I think I think Robert's gonna. But Pauline, do you have a question? Oh, well, Pauline's got a question for us as well.
So there's two.
Okay.
Okay. Hopefully I can summarize as well. So while portraying the wash from a system perspective, a large chunk is on practice elements that are strongly influenced by cultural elements. So in a case of menstrual hygiene management in Nepal, the large dominating factor are the cultural elements rather than the infrastructure, as the untouchability during the 5 days of menstruation is less linked to infrastructure, but more linked to cultural practices. So the question is, what are your kind of opinions and thoughts on that and how it relates to looking at WASH from a systems perspective? So menstrual hygiene and culture. That's one.
You go. Yeah, we'll do a few at a time, yeah.
Okay, let me scroll back up. Okay. This is maybe a technical question. In Somalia's context, we have WASH interventions, doing hygiene promotion, awareness raising, community gathering, household visits, training hygiene promoters. However, they found in an online CAP survey that hand washing practice is approximately 60%. What are the technological aspects or methods that we can use to ensure the community adapts to the hand washing practice, despite kind of the challenges like adequate water and soap availability at the household level? A little bit more technical. Yes, great.
Okay. And while our speakers are thinking about those questions, I'm going to give them one more question to think about. Lisa, you've talked about data-driven approaches, and I think for hygiene, which is, we've already talked about that institutional home of having a lead agency potentially in health, and so and we've talked about the difference of it being from the private sphere as well. How is that data changing? What different types of data are we going to expect, and how do we build capacity to get ready for that? Because I think, you know, WASH is very used to engineering measures, and you know, JMP have done a lot of work to shift that to service level, but you know, there still is an intrinsic reliance in the sector on, is there a sink, basically? How are we going to bring new types of data into this sector? So you've got 3 questions there then on cultural practices, technological aspects, and data, and capacity building. Who would like to go first?
I can attempt to say something intelligent or semi-intelligent about the first one. Yeah, I think the system strengthening building blocks can sometimes come across as quite technocratic, quite yeah, and you can lose that cultural people focus, behavior side of things. Yeah, and I think we need to think through how culture and behaviors and the people we're trying to support fit into these different building blocks, and particularly for hygiene, where there is this strong personal element. I think, yeah, we could do a bit more thinking around that. I'm not sure we're there yet.
Okay, thanks, Jamie. Lisa, do you want to go next?
Sure. I think the question around data and in a certain sense cultural practices is slightly linked. So perhaps addressing it in different ways. So firstly, I think there is a home for analyzing data, and I'm going to check the kind of communication for development institutes, whatever they might be called in different countries, have a critical role to play, I think, in the hygiene sphere and in public health. And with the Hygiene Behaviour Change Coalition's work during the COVID-19 pandemic, a lot of the digital tools were captured, and they're all housed at the Hygiene Hub's website at London School of Hygiene and Tropical Medicine. So definitely do have a look at those. For me, those are part of our kind of legacy and being prepared for a future pandemic or some of the epidemics that we're seeing. So that's really important. The types of data that came out were, I mean, the importance of understanding what the beliefs were, what the behaviors were, what the social norms are, all of that has been captured. Now, obviously, I'm not a specialist, I haven't done that type of work, but that is all captured, and that is how the messages were designed. And those digital, online messaging, but also the face-to-face campaigns. If you think about 20 years ago, it's changed immensely in terms of how we do things. And just on the link with menstrual hygiene and kind of, really localized cultural practices as well, I think it's really important to empower local hygiene workers, but also peer-to-peer groups that work really quite well in schools, where you have women of a similar age working with girls in schools to identify what the taboos are, what the needs are, and kind of but are in a position of being able to then bring that into a broader dialogue with local governments, with the school head, with parents, with boys and men, and I think that's where that information and that data has different elements, right? There's the very local one, but it's about empowering people to use that locally, as well as ensuring that we have kind of the digital and the broader kind of data sets around behaviors and social norms that often are best housed within this what do you call them, the community, the communications for development agencies often housed within the Ministry of Health. So strengthening their capacity is probably a good way forward as well.
Great, thanks. Bruce.
Well, maybe I felt like the first 2 questions touched a little bit on behavior change. there's a cultural, I guess, dimension to it and many other dimensions to it. And I don't know, part of me feels like, yeah, there's a lot that can be solved by having sufficient access to hand hygiene that's convenient and close by. That will not, there are always going to be people that walk away from, a sink with running water and soap and don't wash their hands. But I mean, that's when we can look at the health sector, and we've all been in healthcare facilities where there's alcohol-based hand rub everywhere. You walk into a room and, the doctor can walk 2 steps and wash his hands, and visitors can wash their hands and are obliged in many ways to sort of like challenge to wash their hands with a whole. Anyway, all I'm saying is that I feel like we're missing that piece of it, because I do think don't have the academic studies. I'm sure there are some where, if you make it even slightly inconvenient, like people just are going to fall away. So I do feel like that there, and that's why, I'm more comfortable speaking on the government side than the private sector side, but the government needs to, make sure there's an enabling environment to get those systems in place. And then I think we can also learn from the food safety people on key moments, because, there's this issue of like, should you be washing your hands all day long? Let's be honest, like, it's a little bit like, brushing your teeth. You do it, but we should be very clear that, there's certain times before, we know it, right? After the bathroom, before food preparation, those kind of things. And maybe in some additional times, now that we've, learned a little bit more about, spreading disease in pandemic or epidemic times, before coming to crowds and after seeing a lot of people. So anyway, I do think we need to, make it easy and make it a bit more reasonable, because people have many things that they need to think about during their day. Over.
Thanks very much. So I'm not going to try and summarize that discussion too much, but thank you very much to the session organizers, to Robert and Pauline, for allowing me the latitude to have this discussion. This has been great fun. So if you could just join me in thanking our panelists and our speakers as well for their engagement in this session. Thank you.
Thanks.
And I'll hand back to Robert.
Thanks, everyone. I realize we're over time, and sessions are usually kind of only a small part of your overall conference agenda. So thank you for accommodating the extra time around the fire drill. And yeah, we look forward to kind of continuing this. I think as system strengthening has taken an increased prominence within the WASH sector, I think now is a good time for us to start reflecting on what are the challenges kind of bringing hygiene as a central part of that. And how do we grapple with some of these things? I don't have a silver bullet or a magic statement that's going to wrap all of this up. I am struck by the number of times that we talked about kind of making sure that kind of, this balance between synergies and making sure we're kind of holding the entire hygiene system in our head at the same time. But all of the examples we have are very specific and very concrete and very bound systems. So how do we balance this kind of nebulous, amorphous thing with these very concrete and realistic opportunities where we can make real traction on kind of improving the hygiene system? So hopefully this is the start or continuation of a much longer dialogue that we'll be having across the sector and in the coming years. So thank you again, and enjoy the rest of your conference. So.